Hi, everyone.
Hi, everybody.
Glad you
It's
could
Christy.
join us. Wow, what a day, huh? What a day. So thank you for taking your time to listen to us tonight. We're going to talk about pre-hypertension. Pre-hypertension means pre-high blood pressure. What does it actually mean? When you do a blood pressure reading, what is it actually measuring? It actually is measuring how hard your heart is working. When you have prehypertension, that actually can double your risk of heart disease or stroke. There's two numbers when we're measuring blood pressure. The first one is the systolic blood pressure, or the top number, and that is measuring when your heart compresses, okay, and it pushes the blood to the organs and to the extremities. The diastolic, or the bottom number, is actually measuring the relaxation phase.
A systolic blood pressure of 120 to 139 and or a diastolic blood pressure of 80 to 89 are consistent with prehypertension.
That's exactly right. And you wouldn't think that, would you? But anyway, just remember those numbers, and we'll post them afterwards so that you'll have them. So what do we do about it then? What do we do about all of this? Well, we know, all right? The good news is that everybody who has prehypertension does not have to take a pill. We know that if you lose weight, that you could actually I was going to say the bad news, or the not so good news, is that it requires work and lifestyle modifications on your part. You've heard that many times from me already in the past several weeks, and it really always does come down to that. The smaller the waist size, the lower the blood pressure. Now, there are some skinny people walking around with high blood pressure, but the majority of the people, the cause is by being overweight. So let's talk about the causes. Like I said, the primary reason is obesity. Other causes could be...
Younger adults are more likely to have prehypertension than older adults.
That's right.
Sex, it's more common in men than women to have it. Race, African Americans often develop it at an earlier age.
The other thing is having a familial history or a family history. If you have a first-degree relative, which is a parent or a sibling who has hypertension, then you're more than likely to develop this condition. Other things is not being physically active. That's certainly going to cause you to have hypertension. A diet that's high in sodium and low in potassium can cause you to have hypertension or prehypertension.
Tobacco use, including chewing tobacco, also can cause you to have prehypertension.
Yeah, and hypertension as well, Sue. I think
Right.
that's what you were going to say.
Yes, thank you.
So
The teacher.
the other thing is drinking too much alcohol. Now, we have to quantify what does actually too much alcohol mean. Believe it or not, a man can have no more than 2 drinks a day, and a female only 1 drink a day. Let me tell you what those drinks mean, okay? So that's 1 drink is equivalent to 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of 80 proof liquor. Certain medical conditions like diabetes, sleep apnea, kidney disease predispose you to prehypertension. Certain medications like birth control pills, cold remedies like decongestants, over-the-counter medications. You all know how I feel about NSAIDs, Aleve, naproxen, ibuprofen. They cause hypertension, real kidney problems with those medicines. Also, illegal drugs like cocaine, amphetamines will cause you to have hypertension or prehypertension.
Many times high blood pressure develops gradually over many years without a specific identifiable cause.
Exactly. So there's some certain strategies that you can undertake. One of the best dietary strategies is the DASH diet, D-A-S-H. This is a diet that has been well studied for years and years. And the premise is they think that it works with your salt and potassium, and that works on a cellular level. So a DASH diet is high in whole grains, fruits, veggies, and low in saturated fats. Exercise 1 hour a day is recommended, but a half hour is certainly better than no exercise at all. All right, so Susie, what are the things that we can do?
So weight loss, stop smoking, get more active, get treatment for sleep apnea, and avoid over-the-counter medications that can cause increased blood pressure.
Absolutely. All of these things, good little tidbits. On Friday, we're going to continue with hypertension. If you have specific questions, certainly feel free to send us a message, and we'll be glad to answer that question. I'm going to leave you with our quote, or a different quote, obviously, today, but again, it's about kindness. Guard well within yourself that treasure called kindness. Know how to give without hesitation, how to lose without regret, and how to acquire without meanness. George Sand.
Get out and exercise, everybody. It's a beautiful night.
Thanks, everybody.
See you Friday.